Okay, webinar has begun. Hi, Dr. Adams. Thanks for joining today.
Thank you for having me.
No problem. So you were saying you're up in Seattle, so you may have some crazy weather affecting your internet.
We have a little bit of a rain apocalypse happening here right now, but living in the Pacific Northwest, every single year you hope that it's going to be dry and it's going to be beautiful, but then December hits and you're like, this is why it's green. This is why it's green. It's the mantra you say to make it through the winter until it actually is,
Exactly.
but it's green.
Right? You're like, it's beautiful. This is why I live here for all the greenery. For that, you need crazy amounts of rain. I get it. Cool. Well, thanks for joining today. While everyone's kind of like trickling in, I'm just going to do welcome everyone. Thanks everyone for joining, and then do a little bit of housekeeping so everyone knows how the session's going to run. So I'm going to do a quick intro for Dr. Adams, then for myself, and then we're going to dive straight into the session. This is all about fertility and the holidays and how to navigate the stress of it and how different people navigate it in different ways. Dr. Adams and I were chatting a little bit about that actually, so I think we should dive into that more as we go. Um, but our session will run for about 30 minutes. Drop questions in the chat if you have any, and we'll get to those at the end. If you don't have any, that's totally fine. And then the recording will be shared afterwards through email, especially for anyone that couldn't make it.
I love it.
Amazing. Okay, great. So I'm just going to do a really quick intro for Dr. Adams. And I actually love the one that you have on your bio for Pacific Northwest. So I'm actually going to read that one.
Sure.
Um, so Dr. Shannel Adams is a board certified reproductive endocrinologist and infertility specialist, and she's highly skilled in all areas of reproductive health with a particular expertise and interest in third party reproduction, oncofertility, fertility preservation, male fertility, and holistic care of the mind and body. She graduated from Duke University with an undergrad in ethics, degree in ethics, and went on to the medical school at Oregon Health and Science University. She completed her residency at the University of Hawaii John A. Burns School of Medicine and did her REI fellowship, that's her endocrinology and infertility fellowship, at the University of Cincinnati. So welcome. And then for myself, I'm Claire at Sunfish. I'm head of partnerships. I've been in the field of fertility for about 10 years. Started off as an embryologist and an andrologist in the lab, doing the person creating the embryos. And then ever since then, I switched to the patient-facing side and have been on the side of how to afford and finance IVF.
Very
So that
important.
Yes, very important. Okay, great. So I wanted to dive straight into basically it's December, it's the holidays. A lot of things are happening. Usually the clinic gets really busy because a lot of patients are going through or trying to finish up their cycles or even get their consults in because a lot of people are waiting to start in January. So right there, I think outside of even the family, there's a lot of hustle and bustle. Are you seeing that a lot with your patients? What's the stress level like?
Oh yeah, I mean, December is very, very busy. I think something that's very important for patients to know is that typically most clinics do have a short, what's called a shutdown period. It's not that the clinic is closed. You can come in, you can get blood work, you can do consults, you can even do IUIs, but the lab's very important to the success of the clinic. So we want to make sure that the lab is always at top notch. So typically once a year, the lab kind of shuts down, meaning that no one can have an egg retrieval, no one can freeze an embryo, no one can freeze an egg, no one can thaw an egg. And it's for about 2 weeks, just so the lab can go through, they double check all of our numbers, they triple check all the machinery. They just kind of do like a quality control thing to make sure that, again, we're always going to make the highest level of care. Some people forget about that. So they're like, oh, yeah, I'm going to have time off, around the holidays. I can like probably just go through and have retrieval. I don't care if it's on Christmas Day. We don't do that. So sometimes it's very stressful because they'll be like, oh my God, I'm running out of time and my deductible's happening. So like a very important thing is that whatever clinic you're with, you want to double check and ask them, do you have shutdown times? Some clinics do it in the summer and some do it in the winter around the Christmas time. But either way, those are two times people are like, I can definitely get this done, but your clinic may not be available. So you want to kind of plan accordingly.
Yep, totally. And then with that, I mean, there's a lot of stress with getting in your cycle, planning when you're going to do it. And then there's the holidays. You're going home, you're seeing family. People might be discussing things, asking, oh, when's the baby coming? Everything like that. Do you have patients that ever around this time talk to you about like, oh, I'm really stressed out right now. What should I do? Is it going to affect my treatment? Do they ask questions like that? Do they bring up stress?
They definitely do bring up stress. I mean, I would say if you kind of like outline it family, right? Family is great, and family also can sometimes not be great. So I always tell my patients, as we get around the holidays and you're going to go visit family, sometimes people are going between, one partner's family and the other partner's family. Do we go back and forth? Do we have to travel? I really tell them to take a step back because, you are the most important thing. So I'm like the one person I'm always going to say, you're the most important, and no is a complete sentence. So if you don't feel like you can do it, then don't do it. They'll get over it. This is, it's the holidays. But if you want to go, let's figure things out. So like in terms of like stress, I mean, I offer myself up all the time. I offer myself up as tribute. I tell my patients, if you want to tell your mother-in-law that, the doctor said you can't travel, by all means, throw me under the bus if you don't want to go. Sometimes you just need that excuse or that person to allow you to make that statement. And a lot of times I'm like, I'm here to support it. I'm here for you. But people are always concerned about, who do I need to be around? If there's so much stress, is it going to affect my treatment, my pregnancy rate, or if I'm pregnant, my pregnancy outcomes in general? We kind of go back and forth about it. I think a lot of us doctors talk about like stress, right? It most definitely contributes to your fertility, but it's really hard. It's not like a one-to-one, if you will. Obviously, we want you to be in the best mental state when you're going through this process because you already just have the stresses of scheduling appointments, taking medications, how you're feeling emotionally on those medications. So if you can minimize those things that are around you, it would be best. Now, that being said, if stress stops you from getting and staying pregnant, people would not have babies in times of famine or war, and they do. So I don't want people to stress out about being stressed out, if you will. But I do want them, again, to take a step back, do some strategies, and see what would make them feel best in this moment. So a lot of times it's just knowing yourself. So when we talk about, oh, there's a lot of stress, I have to travel to North Carolina to see my family or New York, or we're going to have a long trip internationally, what should I do? So I think it's really important to look at what's going to make you feel best, if that makes sense. Not what other people feels best, what you feel best. If it's going to make you feel best that you're going to go see your grandmother turning 90 something years old in Ireland, yeah, do it. But what can we do to help you feel good about that decision? That's our plan. So it may be you might take some time off, right? Maybe we're going to do that trip first. And when you come back, we're going to do treatment. Or maybe we'll do it right before and have a plan of when you go there, you're going to have your medical records, you'll have all your questions written down and your answers, and then communication with the clinic if anything pops up. But it really is kind of focusing on, again, like I said, yourself, right? I think a lot of times in fertility, people, for some reason, take about other people, but I mean, it really should be about you right now. It's all about you. So you really, truly have to know what you're able to do or want to do. And it's the hardest thing is like want, because you're like, well, I do want to go, but you kind of don't want to go. And that's okay. You got to know that that's okay. So it's really, each individual person I have. So when I have patients with different problems about where am I traveling, where am I going, who am I going to see, it's like, what do you truly want to do? And I'm not going to judge you, right? I don't know. I don't know your family. I don't know them at all. You just tell me what you feel like. And I try to take that feeling or that what they say as to how much they kind of want to do it and then kind of help support them in their decision, if that makes sense. I always, your REI is here to support you.
I love that. I kind of love also that you're like, it's okay, throw me under the bus. Just say, oh, my doctor said I couldn't travel. Like, if you
I can
genuinely don't
travel,
want
I
to
can't
go.
be around so many people at this party. Yeah, throw me under the bus. It's fine. I'm happy to put it on paper too if you need it.
I love that. That's amazing. Yeah. So outside of that, I mean, you like when patients are saying like, oh, they're stressed and they have to go do these things. You and I were talking about stress management in general. Everyone has a different way of going about it. Some people do yoga and breathing techniques. And then we were saying like, oh, I just need to like work out when I'm stressed. Do you make recommendations around what steps people can take to try to manage during treatment and the holidays, what to do?
To do, yes, yes, yes. But again, it does depend on the type of person you are. As we were talking before, for my A types, probably like me, it's really hard for me to sit down, settle my mind, breathe deep, and do yoga. And then I get worried about the fact that I'm not doing it well. So that I don't, those are just things I don't gear toward. So if you're an individual who is like out there on the move, A personality, like find the exercise you like. I love Pure Barre. I do it like 6 days a week. I love it. I love it. I love it because I can focus on myself and I'm my own like benchmark, if you will. I'm not fighting against anybody else. I'm not running against anybody else. I'm just doing me. So, I'm like, well, what do you like to do typically? Oh, you like to do yoga? Then yes, make sure that you do more yoga sessions. Are you a person who does meditation? Yes, do some mindfulness. There's a lot of good things online and apps that you can follow with it. Specific ones with fertility. If you're a person who really wants to have guided meditations, then go to areas where you're going to have guided meditations. Again, it's all about a collaborative and a multidisciplinary team that you're going to have. So my patients that need that patience, that guidance, I'm like, okay, do your yoga, go to your therapist. Oh, you're a person who likes to be very calm. Do acupuncture. There's a lot of good data out there right now that acupuncture really can improve outcomes in terms of just IVF and frozen embryo transfers. And I also think it's a wonderful opportunity to basically schedule time that you have to be mindful because you have other things to do. You have work to do, you have things to do around the house and family to see. So if you're a person who's like, I really want to do that stuff, I love it, but I just can't plan for it, make that acupuncture appointment. You're going to go, you're going to be relaxed, you're going to be by yourself, you're going to have your needles in, you're going to be calm, you might have your red light. You really have to build it into your schedule. And again, if you're someone who likes to work out, we pay for gym memberships in different classes. So once you commit to pushing the button, you're going to go. It's going to happen. You're planning for it, if you will. And then again, if you're a person who's like, I just want to talk to somebody, it's normal to want to have a therapist. I think 90% of us need to talk to somebody and talk to someone who's not going to judge you or even make a statement. Because sometimes when you're feeling frustrated or you're feeling stressed out and you just want to get it out, not necessarily have a solution, if that makes sense. And therapists are really great for that. Here at PNWF, we use self space. We actually have a support group. And so some people want to be around other people that are going through the same thing and maybe not have to go one-on-one talking to them, but also hear their story so they can kind of like digest that information. So yeah, I try to look at the type of person they are and like what they typically do to help themselves be grounded or focused in a normal situation outside of fertility, and then kind of encourage or say there's a different opportunities. So if it's acupuncture, if you don't have one, we have a list of acupuncturists that we recommend in the local area. Again, we use self space, therapists in the area as well. If you're a person who likes to work out, what kind of things do you want? Let's talk about gym membership. Let's talk about different things you can do to kind of regulate your heart rate and get your body and your juices flowing so you can feel a little bit more calm in those moments of like exercise.
I love that. And I think that you're right. Like different people are going to need different types of methods to manage their stress. Like one size does not fit all when it comes to that. So I think that people have to find what's going to work for them. Like just because one person likes acupuncture or one person likes to go to yoga, like it might not work for you. But that's interesting that the research, I keep seeing like changes in the research with acupuncture too. Just more keeps coming.
More and more keeps showing up, and it's different aspects to making sure that a cycle and your outcome is as most optimized as possible. As fertility doctors, we're always going to talk about, the potential medications, the timing, but it's all the different things that you put within your body and expose yourself during that time that just kind of adds to the benefit of being successful. And that can include like, the supplements that we have you take if you're doing acupuncture. And then again, just scheduling that time to take care of yourself because self-care is very important. And I mean, self-care could be going to get a facial. You're like, no, I ain't
Yeah.
high school, go get a facial. I'm not talking to anyone. I steam, I feel beautiful afterwards, or a massage, just to kind of take time for yourself. Because again, the major thing around this stress level is you get so caught up with the process. I got to make this appointment. I have to do this. I have to do that. Oh, now I have to see my family and I have to bake this or I have this party to go to. And you really forget about yourself. And self-care is so paramount for making it through this because, you can't pour from an empty cup. You have to fill yourself up so you can make it.
Totally. No, I agree. And with that being said, actually, with the things that you put into your body and everything like that, I'm curious with the holidays, there's a lot of change and like with travel, there's a change in sleep, routines, but also maybe what you're eating, how much sugar you're eating, alcohol. Like, does that actually, like if someone's cycling in January, like, and they're asking like, oh, what about, can I have alcohol over Christmas? Like, what do you say?
So I always tell my patients, yes, because if you're an individual that has a glass of wine here and there, or you really like to enjoy the holidays because you're around fans and people and you're celebrating, that's totally fine. I mean, we're not talking about binge drinking, right? We're talking
Yeah.
about having, maybe 3 drinks a week or within a time frame, and that's not going to stop the success of your process. In terms of like eating, obviously healthy, non-processed things are best in your body, but sometimes you like a piece of cake here and there, and that's totally fine. Everything we need to do is in moderation. And if you're really looking at that, having a glass or two of wine or champagne during the holidays is fine. Eating that delicious cake that you really like is totally fine. We talk about caffeine. We live in the Northwest. We love coffee here in the Northwest, and we love our caffeine. They've done studies. You're okay to have a little bit of caffeine here and there. We usually recommend no more than like kind of 2 servings per day, but like a normal serving, like a grande. We're not talking about those Trenties, etc. So just keeping everything done in moderation, and then not, being hard on yourself when you're like, oh, just have an extra piece of cake. That's totally fine. Again, that one piece of cake that you had at that party is not going to stop you from being successful. Now, that being said, again, everything in moderation, weight does impact fertility outcomes. So we always want people to be mindful of their weight, but that's, again, just a lifestyle for modification. So eating normal, eating healthy, working out when you can, and with what exercise you can do, which could be walking or it could be, high intensity HIIT training. But doing those things. And again, just thinking a little bit more about moderation and weight, something that I think is very important that we don't talk about is, weight can affect implantation. So patients who have very high BMIs that are technically, above 35 or 40, the nice thing is now that we have other options to help people do things. So, we do bring it up with our patients, and, one of our providers has actually done like a complete presentation at the university looking at GLP-1s because everyone like, are these bad? Are these good? Should we use them? And a lot of them people use it as a kickstart. But the major thing is that if you're using it, it should be with a licensed professional. I would say talking to your primary care doctor. What are your goals? How are you going to take these? How long are you going to take them? Are you going to have enough protein in your diet, fiber, etc.? And then sometimes people will do kind of IVF, which is great. When we get eggs, we want to get embryos to use. And then you can take that time off to lose weight to maximize your BMI prior to a transfer. And again, it's just a plan, which again, you have to think about as a whole picture, because the major stress about this process is I wanted to get pregnant years ago or last month or a year ago. When you're going through this process, we want you to be successful. So sometimes success takes a little bit of a roadmap and time.
Okay, so that's really interesting because I was going to ask about that. So yeah, so it sounds like when it comes to the transfers, BMI is really important. So just managing weight. Okay, got it. So over the holidays, anyone that's prepping for that. And then I know for the egg retrieval, like 3 months in advance, people are starting to prep, take supplements because of the egg quality factor there. Is that still right?
Yeah, it's about kind of 2 months in advance that you would have kind of a benefit with egg, and it's 3 months for sperm. So typically, when we first meet with patients, some of them are on some of those different supplements, if you will. We kind of walk them through the things that we would highly recommend. I mean, obviously, for women, a prenatal vitamin, any prenatal vitamin will do that you can tolerate. They've got gummies out there now. They've got liquid, they got vegan ones, etc. Men should be on a multivitamin, like a men's one a day. We do recommend things like vitamin D. Vitamin D deficiency has been associated with infertility, and we live in the Northwest, so almost all of our patients, we tell them to go ahead and be on a little bit extra vitamin D. Vitamin C is good. It's got antioxidants, good for sperm, good for eggs. And then CoQ10, which I think everyone's heard about, has a lot of good data in terms of sperm and health, and even things like fish oil. So oftentimes when you establish with your provider, be like, well, kind of what are some of the supplements that you can would recommend for us? I mean, a lot of us don't recommend a brand per se. It's what you can kind of tolerate, if you will. And that being said, some people are just not really good at supplements. Again, we encourage it, but I don't want you to be stressed out because I'm not taking every single supplement that's in a book for me to be successful. Let's do what's best for you that you can be consistent at. Same thing with when people are working out. What can you do that's consistent each and every time?
That's awesome. I love that. Yeah, when patients purchase their IVF cycles through us, we actually do give them a free month, I believe, of prenatals just to like kickstart them and get them started. So I think that's great that supplements are really important.
They are. Yes.
Um, yeah. So I'm wondering for people that, let's say they're already actively in treatment and they are prepping for an embryo transfer in the new year, maybe they've had some failures or some losses. How would you recommend people kind of navigate during the holidays, the disappointment or maybe the impending treatment? Because I know that it's probably on their mind a lot. Do you have any
Yeah,
thoughts around that?
yeah, I've a lot, because right now we're kind of nearing our shutdown, and people are like, oh my goodness, so now I have to wait to the holidays to go through it again. Again, I think it's really just understanding yourself and what you potentially need, because when you are around family and friends, they want to think about what's positive, what's helpful. People are having babies, they know you're trying or potentially don't know that you're trying. So it's making sure that you surround yourself in situations that won't cause you to dwell more on it, if that makes sense. Again, that's why, again, I tell people, please use me as a scapegoat. If you're going to go to a family function and your sister and sister-in-law both have brand new babies and you're like, that's going to trigger me, that's fine. Know yourself. Don't trigger yourself. Don't force yourself to be there. And I always tell people your feelings are valid, because a lot of people are like, well, I should be able to just do that and just suck it up. You don't have to. Your feelings are valid. So if you don't feel like it's going to be the best situation or environment for yourself, please try to remove yourself. Do your very best. Again, take care of yourself, because Next year, when we have a transfer and everything, after you, yes, you can go pregnant, all excited, etc. But you don't need that extra kind of just stress that you could avoid. I say avoid it if you can.
Definitely avoid it if you can. Yeah, I know that sometimes when you are at those sort of gatherings, there can be surprise pregnancy announcements because people want to wait to tell everyone when the whole family is there. So I'm sure that's really difficult. Yeah, do you have any thoughts around that?
Yeah, I mean, I think a lot of times it's just kind of taking a deep breath, and I always tell people, yes, everyone celebrates a different way. Um, but you don't have to go too deep into it. So if someone's like, "Oh, we're pregnant," you can be like, "Congratulations!" Don't necessarily need to bring up your story. Maybe that event might be a little bit shorter for you if you start to feel away, because again, you need to take care of yourself. Listen to your inner voice. Everyone has one where you're like, "Okay, okay, now I'm really anxious. Now this doesn't feel really comfortable." Sometimes you just have to excuse yourself, be like, "Oh, we're getting a little bit tired. Maybe I should." We might leave a little bit sooner, or maybe remove yourself from that conversation. Because in my family, at least, there's multiple rooms with multiple conversations going on. And if the kitchen is the
Yeah,
room talking about the baby announcement, maybe I want to go to the den where people are watching, a Christmas story, Elf, something like that.
right. No, that makes sense, right? Just like congratulate them, but then just remove yourself and go somewhere
Correct,
else and be like, okay, I'm
correct,
gonna put my attention on something else.
correct. And then another little thing that I've had happen before is when patients were like, but then they ask, when are you going to have a baby? I think that's like the worst question that you can ask anyone who's trying to conceive, because they're like, well, obviously I'm trying, and again, you should know that you have the authority as well as the right to say, we're still going through things. You don't have to explain or tell everyone the details unless you feel like it. But oftentimes, the individual is just asking it as a quick question, right? So when people are like, "How are you doing?" Sometimes they don't really want to know the answer. They just said it, and just being able to take a step back and be like, "Oh, they just made that statement because they know we're trying. Oh, yeah, we're still trying." That's it. You don't one line. You don't have to get into it. You don't have to work yourself up. You don't have to perseverate on it. And again, you could just say, "We're doing good," and again, walk away. Really, really focus on yourself and what's good for you.
That's really smart. That's a good way to go about it. And then I wonder with when it comes to for people that have a partner that's supporting them and going with them through the process, I feel like that's really important that you're
Yes.
really tight with them. How do you make sure that you're supporting each other through this process? Like, what have you seen as the best practice?
I think when both partners are involved as much as possible. So we always let our patients know that you and your partner can come to all the different ultrasounds. When we're having these consults, just talking about each step, that's one thing I've really enjoyed about, post-pandemic fertility treatment, is that a lot of our communications or consults can be here doing Zoom. So I can have one person that's at home and one person that's at work that still can take a point where they're both involved in the conversation. Even if the other partner's not saying anything, they're there listening and being able to support in terms of what they need. And then again, this whole process can be stressful. I hear it very oftentimes when couples are actively trying to conceive through timed intercourse or inseminations, that, they're like, it just doesn't seem fun anymore. Our relationship is suffering. And so, at that point in time, I'm like, have you ever thought about talking to a therapist or a counselor? Because sometimes, again, it's having a mediator, a professional, who will let you kind of talk about your feelings and kind of dissect different things so you can have open communication and there's no resentment and there's no kind of like breakdowns in the relationship, because that's your partner. You should be most honest with them if you can be.
That makes sense. Yeah, I was thinking from my perspective, because what Sunfish does with Visit Northwest is we help patients afford IVF. I see that a lot of the ways that male partners specifically like to support is that they kind of like they are the ones that actually call in a lot. They're like, okay, I can't do the treatment. I can't go into treatment for her, so I'm gonna call in and figure out the whole financial piece. Do you see that as well on your side?
I would say on my side, the more clinical side is the injections. So because they're both there together
Oh,
doing the injection.
yes.
So obviously, it's we use small needles, so they're subcutaneous injections that people take for the stimulation medications or sometimes oral pills. And so that's one nice thing when you have a partner, is sometimes your partner will like, well, okay, well, I'm going to take the injection class with you, which is usually an online module, and I can give you the injection. So that's kind of a moment that they touch base each day, if you will. And they're like, all right, are you ready? We're going to do this. I'm mixing these things up. I'm ready. Take a breath, 1, 2, 3, and they also feel involved in the process.
That makes sense. So that's actually a really good point. So one way that you can support your partner is actually just like taking over like the injection part and being like their
I
nurse
got your
essentially.
calendar. I'm ready. I am your nurse. I'm taking care
Yeah,
of
I
you.
love that.
Yeah, and I always tell it's always like a joke when I after like egg retrievals when I see partners, I'm like, yeah, this is their day to day, so you're going to do everything they tell you to do. Same thing with after transfers, whatever they want to eat, right? You're like, yeah, of course, whatever they want to do. I will make you a princess for a day, if you will.
That's amazing. I love that. And then for your LGBTQ plus patients that are navigating family building stress during the holidays, do you have any specific guidance for them? It sounds like a lot of this pertains as well.
I mean, I would say in general, for me, it doesn't really matter if you're single, you're partnered, if you're how you identify or your gender or sex. Fertility itself is just stressful. So the problems are the same across the board. And so it's again just knowing yourself, potentially your triggers, and also really trying to care for you because this is, you need to be number one, right? You're going through this, you're experiencing this. And so the best way to do it is just to be, again, open and honest with your partner if you can. If you don't feel like you can, potentially counseling is a good way to open up in that realm and not feel judged or potentially have people cut you off, etc. And again, just kind of writing down kind of again a timeline, like understanding your timeline, you and your partner, what you want to do, what you want. I mean, as providers, we always want to ask people, like the first question is like, how many children do you want? And people are like, well, I'd be happy with just one. I was like, I want to know literally what's on your Christmas card. It's like the word I say. What do you see on the Christmas card? In your mind, there's a Christmas card you see. Is there one baby? Is there two? Is there three? And if I know that, I can help you navigate this process and help you with expectations because expectations are very important. Because if you expect one thing and get something completely opposite, that's when you can have that stress, that torment, that turmoil. Did I do something wrong? But if I know what you want, I can talk about expectations so you can have a reasonable idea of what the timeline might look like, the probability of getting that ideal Christmas photo, if you will, so we can kind of work through this process step by step.
I love that. Okay, she's asked them what's on the Christmas card so that
I
you can
literally,
get
I'm like,
a
they're like,
gauge.
I would be happy with just one child. I'm like, what's on the Christmas card? Like, what? I know you have a Christmas card. You probably do. You have names probably picked out and you don't want to tell anybody. That's fine. I just want to know what you ultimately want, and I will do my very best as your provider to give it to you.
That makes sense because then you can help them plan essentially how many retrievals they might want to do, how many
How
embryos they
many
need to have.
people, and even sometimes the discussion, sometimes we have patients where your own eggs are not going to be the way that you're going to build your family. So again, that's the third party reproduction. If you're going to need to use donor egg or donor embryo, again, I want to talk about what reasonably would make sense for you to attain the family because it's all about family building. So we want to know what you are looking for so we can help you talk about the different roads to getting there and then the likelihood of success again for expectation so you understand like okay this is fine. I think this is the route we want to go because this is what I want.
That makes total sense. Okay. Yeah. And then I guess I'll like touch a little bit on financing during the holidays, but I was wondering if you could give one piece of advice to someone navigating fertility during the holiday season in general, what would it be?
So I think in terms of navigating the holiday season in general, it's to do your very best to take care of yourself, right? Again, you are number one. And also to be cognizant of what you're doing during the holidays. Like I said before, if you are traveling across seas to see a family member, maybe your fertility treatment is going to be halted this time. And again, that's okay. Tell your doctor. I tell patients all the time, they're like, is that going to ruin me? I was supposed to do back-to-back treatment. I'm like, you can please enjoy your trip and come back. I'll be ready for you. So it's just knowing the things that you need to do during that time frame because if you your plan for success, you typically usually can be successful. So know yourself and do your best to kind of plan by kind of knowing what your kind of your hopes or what things you've committed yourself to that you really want to do during the holidays.
I love that. Yeah. And actually that kind of leads me to the final piece that I wanted to like cover for patients that are going through because I know finances during the holidays is just an added stress because you're spending a lot of money. Like you're traveling, you're buying gifts, you're going to see people, and then you're also like, okay, next year I'm going to be going forward with an IVF cycle. I have to finance that as well.
Yeah.
Um, that's another reason for people to start planning early and think
Yes.
about how much money they need to set aside, how many cycles they might want to do. Like, do they need to do a single retrieval? Do they need to do more than one retrieval to get the family they want? And then prep for that. So, one way to lighten the load that I want to mention is that we've actually partnered with Pacific Northwest with your clinic, and for our patients that are purchasing a package or placing a deposit before December 31st of this year, Sunfish is actually contributing $1,000 off of their IVF package. And then they can start in the new year. They can start January, February, we give them 90 days. So for people that are starting to financially plan, it might be something where they want to discuss further and start to look at their finances now with their partner and figure out how they want to start to pay because it is a lot. And family might end up over the holidays wanting to contribute. So if it comes up.
Yeah. And then the one thing that you can do sometimes is when we're going through this process with medications, like some of the stimulation medications, there's overfill. So you may need, you can combine, we have a combination kit for our patients that they can combine leftover medications so they can get the most bang for their buck out of the medications because there's usually a little bit left over, but you're not going to give yourself 8 injections for one dose. So we show them a way to kind of combine those things. And then there's some people who may have a cancellation, something happened. You're like, oh, this is the end of the world. I'm like, well, at least you have your medications, or make sure you get your medications before the end of the year if you need a deductible or something, because we can use those medications. We know what the expirations are. So we have people, keep an inventory of what you got and what you might need and try to, again, maximize spending dollars, especially when it's insurance dollars as we get to the end of the year.
Oh, I love that. That's a really good tip. I didn't know that you guys had a combination kit. I've never heard of that before.
We do. So it's usually specifically for the medication called Gamalef or Follistim, which is one of the injections that they use for IVF stimulation. So most of the pens have a little bit of overflow and you can still use them. But again, you might have to give yourself multiple injections. But we've shown people how to combine in a vial and the conversion to just pull it out. It's a couple steps, but it makes it a little bit easier and just use as much medication as you can.
Wow, I love that. Oh, that's like a really good tip to leave off with, I feel like. Amazing. Okay, well, I'm gonna check to see. I don't think we had anything come through in the chat, so that's great. But amazing. Well, thanks, Dr. Adams, for joining. I really appreciate it. Do you have good holiday plans?
Oh, I'll be actually working here. So our lab will be closed, but I'm on call. So I'll be here all the holidays.
Oh, wow. Okay, so you'll be there even Christmas or no?
If anyone needs something, I will be available. I'm the person on call.
Amazing. Okay, great. Well, thank you for joining. And then how can people find you and reach out to you if they want to schedule or get a
Yeah.
consult?
Well, yeah, I'm at Pacific Northwest Fertility, so you can always call and make an appointment. And I'm also on Instagram, Shannel Adams MD. And have a lot of information there.
Amazing. Thank you, Dr. Adams.
You're
Thanks
so
for
welcome.
joining. Thanks, everybody.
Take care. Happy holidays.